All right, so good afternoon, everyone. My name is Lisa Smith. I'm the Executive Director of the Washington State Microenterprise Association, and we are really excited to have you join us today. This is an exciting workshop that really is focused on helping employers and small businesses find the right health coverage that's right for your business. And we're excited to welcome Marie Cooper, who's a Senior Small Business Outreach Coordinator for the Washington Health Benefits Exchange, as well as Thea Feltz, who's a small business owner who has that kind of recipient perspective on what it means to get health insurance and why is it important. We were going to be welcoming Brandy Andrews. She has a family emergency, and so I just want you to hold her in our hearts today, and we will just proceed with the speakers we have today, and I'm very fortunate for that. I want to make sure that you all just know that you can put questions in the question and answer box at the bottom of your screen. You can also put them in the chat. I want to say thank you to our partners who helped us make sure this happened: the Washington Health Benefit Exchange, the Washington Healthplanfinder, the Washington State Department of Commerce, One East Side Spark, and of course our speakers. So I want to begin just by saying thank you. This is really a big deal. A lot of employers are not even aware of the options to find health coverage. And I'd like to begin just by introducing folks to the Washington State Microenterprise Association, because we work with partners all over Washington who are really working day in and day out with businesses on the ground. And I'm just going to do just a short video about that. 1 second. So I'd like to begin just by focusing on the work we do and why the work what we do is important. We are an organization that is supporting nonprofits that are serving small businesses. Today, of course, we're going to be welcoming these two speakers talking about health coverage and options for small businesses. WSMA is focused on helping nonprofits sharpen their saw and build their capacity to reach and serve small businesses. We do that by capacity building, training, programs like today, workshops that help nonprofits reach and help businesses with the services that are vital for their profitability and their sustainability. We provide small grants for nonprofits to help them be strong and build their capacity to reach more businesses in rural communities, more Black, Indigenous, and other entrepreneurs of color, more people with disabilities, veterans, rural, LGBTQ+ entrepreneurs. And finally, we help bring together partners on Evergreen BizLink, which is a place where any business, anywhere, can look for the business resources they need to grow. And there's a link here if you are interested in learning more. We'll also put a link in the chat. So you can find us on different social media platforms. I'm very excited just to be here as a partner. And I'd like to begin now just with having the speakers, if you would, begin just by introducing yourselves, your business, or your organization, and then we'll go into the presentation that Marie will provide. So Marie, would you introduce yourself first?
Yeah, no problem. Yeah. Hi, everyone. My name is Marie Cooper. I am a Senior Small Business Outreach Coordinator with the Washington Health Benefit Exchange. I am wearing a black shirt. I have dark hair, I have brown skin, and I have a blurred background. But I am very excited to be here today and share the resources that we have for small businesses and entrepreneurs. And yeah, I'll pass it off to Thea.
Hi, everyone. My name is Thea Feltz, and I am a small business owner with, I own and operate Comparative Solutions. We are a health insurance agency that specializes in helping individuals with individual health insurance as well as Medicare. And I am wearing a brown turtleneck kind of collar today with a blurred background as well and brown skin. And I'm very excited to be here to share my experience of Washington Healthplanfinder and small business insurance.
Excellent. Thank you both. And my name again is Lisa Smith. I'm an older white woman with blonde hair with a blurred background and a purple shirt. I'm very excited to be here today. So I know, Marie, you have a slide deck, and I want to just begin by saying that the nonprofits that we serve, many of whom don't have health coverage for themselves or the employees in their nonprofits. So when you present today, I would love it if you were to include that sector in your presentation and just share the progress or the work that you're doing. We're fortunate that folks can call you directly after this presentation and in the future to get support. And I'd like to just welcome you to begin.
Okay.
Well, and just to know, everyone in the room, if you have questions, just put them in the question and answer box or in the chat, and we will get to them at the end. So go for it, Marie.
Perfect. Okay. Well, thank you for having me here today, Lisa and Cherie. If you are not part of WSMA and you are thinking about it, they are wonderful to work with. So yeah, thank you so much for having me today to share the resources that I have for small businesses, entrepreneurs, and also nonprofits. That actually is an area that we know also is highly uninsured, or it's not offered by their employer. And so I'm excited to share the resources that we have. I know that small business owners are so busy. They wear multiple hats. They have a list of 10, maybe 20 things that all is important, but having health insurance really is an important part of starting their business and growing their business. And it should be a conversation that we're having with them. So again, I'm really excited to be sharing the resources we have today that we have to support small businesses so we can start that conversation together. So just to go over what we'll be covering, I'll go over some background information of who we are. We'll go over a small business survey that we conducted. We'll go over, the importance of health insurance, insurance options for small employers, what individual plans look like on Washington Healthplanfinder for a small business. We'll go over a new state subsidy called Cascade Care Savings, and then also open enrollment. And that is the time of year when individuals can enroll into coverage. So to give you some background information, the Washington Health Benefit Exchange was created by the Washington Legislature and operates the state's official online health insurance marketplace, Washington Healthplanfinder. At www.wahhealthplanfinder.org, this is where individuals can go to sign up for free and reduced cost health coverage. 1 out of every 4 Washingtonians uses Washington Healthplanfinder, and it's used primarily by people who are self-employed, employees of a small business that are not offered coverage, those that lost employer coverage, participate in the gig economy, work seasonally, and those that do not yet qualify for Medicare. So our team, the Small Business Outreach team, was developed from a legislative package in 2021. From the pandemic, we learned that many Washingtonians were not aware of the ability to access quality coverage through an individual plan on Washington Healthplanfinder. Our team was created to provide outreach to small employers and build awareness of the resources we have available to them in finding quality health coverage. So in approaching this work, we wanted to start by learning more about the small business community and their needs so we could best support them. So next few slides, we'll kind of go over that information of what we learned and a survey that we conducted. So from the research and data we've reviewed, we found that small businesses are less likely to offer health coverage to their employers than larger employers. In the Kaiser Family Foundation Employer Health Benefit Annual Survey, we see that small businesses under 50 offered health coverage at a 58% rate compared to larger businesses that offered coverage at a 99% rate. This was even lower for micro businesses with 3 to 9 workers that offered coverage at a 49% rate. And going one step deeper and looking at Washington State, in the last report done by OFM in 2014, we showed that micro businesses 2 to 9 employees offered coverage at a 37% rate. So this data really showed us that there was a need for our outreach efforts to let employers know and their employees know about their health coverage options on the exchange. So earlier this year, we conducted our own survey for small businesses, and we received 150 responses. This slide just shows the businesses breakout of their size. So you can see that majority of them were under 9 employees. Looks like most of them were 2 to 4 employees. And then we did have some that replied that were just themselves. And asking them if they supported their employees in accessing coverage, 67% of them said they didn't support their employees in finding coverage. And asking why, or why don't they offer coverage to their employees? Majority of them said it was too expensive. Some were unsure of their options, not enough time to manage the health benefits. And then, of course, there were some that probably already getting coverage, maybe from their spouse or maybe on their parents' plan, but were finding coverage in a different way. When asking them to rate what's most important to them in finding coverage, affordable options, and then went to quality health plans, tax incentives, and then a simplicity of options. So analyzing this data, we know that there is a need for small employers and their employees to learn about their coverage options. There are multiple options for small employers to find health coverage that may meet their needs of affordability and quality, and they don't have to give up one for the other. They just may not be aware of it. But before we dive into those different options, we should really establish, why is it even important to have health insurance? So you may have heard people say, oh, I never get sick, or I don't go to the doctor. But even healthy people use the healthcare system. Having health insurance makes sure that healthcare costs are affordable when they do. So for a business owner, they should really consider how being out sick for an extended period of time would affect their business and its growth. Health insurance allows for them to get the preventative care to stay healthy or get treatment quickly if they're not. Health coverage provides an affordable way to get medical care when needed. So these are some common treatments and their costs. Having health plans can help share in these costs. So as an employer, supporting their employees in finding health coverage can also be beneficial. So offering health benefits is a great way to retain and recruit those talented employees. I know with this job market right now, I hear it all the time that I'm just looking to recruit those talented employees. I'm looking to retain them. You know, health benefits is a great way to do that. Another thing it does is shows that you care. It shows, you know, that you care about your employees' well-being. It also can produce more productive employees. Health coverage provides access for their employees to receive preventative care services and immediate medical attention when needed. Having healthy employees can likely lead to less sick and workday absences, leading employees to be more focused and effective at work. So they're able to stay healthy and then come into work and do the job that you hired them to do. They're able to be productive every day. They're able to help you grow your business. So health insurance options for small businesses. So health benefits can be seen in different ways. As an employer that's learning about their options, they may want to ask themselves, what are my goals and needs for offering health coverage? Am I wanting or am I able to contribute to my employees' premiums each month? How much am I able to contribute? So again, there are different health insurance options available for small businesses to reach their goals. So I encourage them to review all the options to find the one that best fits their needs. And looking at the options, individual plans. So these are plans that are owned by the individual. If an employer is unable to contribute to their employees' premiums, this may be a good option for them. Small business group plans. So those may be what most people are familiar with when they say, oh, I got my insurance from my employer. It's owned by the employer. It's provided to their employees. Health reimbursement arrangements. So this is not actual health insurance, but this is an avenue that an employer can use to reimburse employees for their monthly insurance premiums and expenses tax-free. ICHRAs and QSARAs are two popular options. HSAs, or health savings accounts, is also not actual health insurance, but it is a way for employees to contribute to an account that can go to medical expenses or future medical expenses. So again, there are options available for different size businesses and different budgets. I'm available to assist small employers and have resources to assist them in understanding their options. I can, if they're interested in group plans, HRAs, or HSAs, or comparing the different options, I can connect them with one of our brokers in our enrollment centers to help them find the one that best fits their needs. If they are currently already working with a broker in different areas of their business, or they know of a broker, then they should ask them about these options. So although we have resources for group coverage, HSAs, HRAs, I'm going to dive in deeper in just talking about individual plans on Washington Healthplanfinder and how that can help a small business employer and employee get the coverage they need. So the benefits of individual plans. So many small employers and entrepreneurs may not be aware of an individual plan and how it can work for their business. So this can be utilized for all small employers, but more likely by a micro business or maybe an entrepreneur that's just starting and is looking for insurance for themselves and or their family. So individual plans offer a great option for employers who may struggle to meet the minimum requirements of a group plan. So there is no minimum participation or monthly premium contribution requirements with individual plans. So if they are saying that they can't afford to help their employees on their monthly premiums at this time, then this would be a good indicator that an individual plan may be something to talk to them about. It offers a flexibility of plan options. So individual plans allow for employers and employees to choose a plan that best fits their health coverage needs. If you have an employer that rarely sees a doctor, and then maybe have one that has specific medications or needs a specific provider, it allows for them to choose a plan and get the coverage that's right for them. So they don't have to be on the same plan, but they can get that coverage that fits their needs. Small businesses may also opt for this option because they may lack the resources to manage a group plan. So this allows for them to focus on parts of their business that needs their attention. So Washington Healthplanfinder. So this is where employers and their employees can purchase an individual qualified health and dental plan. Employers can support their employees in finding health coverage by providing them the information about Washington Healthplanfinder so they can get the coverage that fits their lifestyle. So, and think about that. I know that it's not really a traditional way where you're thinking, an employer is thinking, oh, I, cover their premiums. But for an employer to say, this is where you can go to get coverage, this is where you're going to get quality plans, this is where I get my coverage, is a way of supporting them. It takes out the stress of having to search through sites or having to look at different information, but being able to be an employer to say, this is where we go to get coverage, is a way of supporting your employees and finding health coverage. So this is also the only place where individuals can access federal premium tax credits and Cascade Care savings to help lower monthly costs. And then for eligible individuals, this is also where they can apply for Washington Apple Health, a Medicaid program, to get free or low-cost coverage. And then quality plans, that is an important part of looking at coverage. You want to make sure you're getting, if you're having health coverage, that things are going to be covered, that you're going to be covered. So all plans in Washington Healthplanfinder offer the 10 essential health benefits that cover doctor's visits, prescriptions, preventative care, behavioral health, and more. No one is denied coverage because they're sick or have a pre-existing condition. So how much does coverage cost? So for those that qualify for Washington Apple Health, it's free or low cost. Over 1.5 million people are enrolled in Washington Apple Health. For qualified health and qualified dental plans, now those prices may vary a little bit, and that's based primarily on age and household income. These are reason why is because those are the main factors that determine the amount of federal tax credits that you receive to help lower those monthly costs. Also, for those that are eligible, there are more savings available for the 2023 plan year than ever before with the addition of Cascade Care savings. And we'll talk a little bit more about what that is. But over 200,000 people are enrolled in these private plans. And then these numbers here, the 100,000 that pay less than 100 and the 34,000, I foresee these to be actually lower going into 2023 plan year with the introduction of Cascade Care savings. It'll be for the first time that we actually have plans that are $0 per month. Exciting stuff in the new year. So Cascade Care plans and Cascade Care savings. So Cascade Care is the exchange's primary affordability initiative. The goal of Cascade Care is to increase the availability of quality, affordable coverage in the individual market. And it does this by offering plans with deductibles that are on average $1,000 less than other plans. These plans cover more services before meeting a deductible, including primary care visits, mental health services, and generic drugs. Cascade Care plans offer Washingtonians more choice and access to high-value plans that cover services before deductibles. And then within Cascade, the Cascade Care program is Cascade Care Savings, which is new for the 2023 plan year. So this is a state-funded subsidy that wraps around an individual's federal premium tax credits to help provide additional savings on monthly costs. So the state premium subsidy amount per member per month is $155. That's a fixed amount. It's available exclusively through Washington Healthplanfinder. The Cascade Care savings amount for eligible customers will display on the screen and be included in the customer notification. And that's similar to how federal premium tax credits appear right now.
Say one quick second.
Sure.
There's a question on one of the slides on what the first dollar services are. Could you just clarify that before you go forward? Right there.
Yeah. So those are just the ones that cover, what you meet before deductibles. Services before deductibles.
And then just, we'll get to all the questions, but there was a quick question is, when will the Cascade Care plans open for enrollment?
Yeah, that's a great question. That is later in the presentation, but I'll tell you now. So it will be available during open enrollment when you're searching for plans. But if you go into the browse tools, and you'll see that later on, it'll be available. We're saying October 21st. Okay, so we'll go into some examples of what this Cascade Care savings looks like then. So this is an example of Cascade Care saving and how it wraps around federal subsidies for those that are eligible. So an eligible customer enrolls in a Cascade Care Silver plan, and it's $500 per month. They have a federal premium tax credit of $400. And so before Cascade Care savings, it would be $100 per month. With Cascade Care savings starting in 2023, $100 applied, and so they would have a monthly cost of $0 per month. So although $155 per month is the max amount, that'll never be applied, or I guess it's because $155 is not needed, only $100 is needed to get to them to the zero amount, then that is what is being applied. So Example 2, so this example kind of shows how customers can use Cascade Care Savings to buy up to a higher level of coverage. So the previous example shows someone who purchased a silver plan and they're paying $0 per month with Cascade Care Savings. This just shows that this individual is able to purchase a higher metal tier, which is a gold plan, with Cascade Care Savings, and is only paying $45 per month. So this example shows how Cascade Care Savings is also available to individuals that are not receiving any federal subsidies. So individuals that aren't receiving those federal subsidies, it's a pretty small population, but it could be those who are those that are in the family glitch, or is being offered affordable coverage from their employer. And you can see how no tax credits are applied, and Cascade Care Savings are still being applied at $345 per month is what they pay. So who's eligible for Cascade Care Savings? So you have to be QHP or qualified health plan eligible, have a household income of 250% or below the federal poverty level. They must enroll in a Cascade Care Silver or Gold plan. And then they must apply and accept all available federal premium tax credits. So where do you sign up? So the official website is www.WAHBE.org. We also have a mobile app that you can download from your app store. So if you wanted to quickly browse tools or browse plans, excuse me, you'll see a menu bar on the homepage of Washington Healthplanfinder, and you'll see the link that says browse and compare plans. Here, this is where you can enter in some basic demographic information and then review the different plans available to you. So it will provide a projected amount of federal premium tax credits that you're eligible for, but it is just a projection. So if you are wanting to know the most accurate amount, then you will want to submit an application. Submitting an application does not require for you to enroll in a plan, but it will give you the actual amount of tax credits that you receive. And then also the Cascade Care Savings amounts, they will not be showing on here as well until after October 21st. So when you're browsing plans, this pop-up will come up and it's called Smart Plan Finder. And this is our online decision support tool. This tool helps really narrow down that search. So if you have specific provider or prescription needs, this allows you to put in that information, and then it'll feed you the plans that best fits your healthcare needs. So when can you sign up? So if you qualify for Washington Apple Health, you can enroll year-round. For those that are eligible for a qualified health and qualified dental plan, they'll want to enroll during fall open enrollment, and that's November 1st to January 15th. However, if you are wanting to have a January 1st start, you'll want to submit your application and enroll in coverage by December 15th. So to get a January 1st start date, you will want to submit and enroll by December 15th. Any enrollments between December 16th and January 15th will get a February 1 start. There is a way for you to get enrolled outside of open enrollment, but you must experience a qualifying life event, such as loss of employer coverage, a move to Washington State, or a change in household size. You typically have 60 days before or after the date of the qualifying life event to enroll. And then these are our carriers for the 2023 plan year. When signing up, you'll want to have your legal names, birth date, social security numbers, income before taxes and deductions, tax filing status. And then you'll want to make sure that you're including all household members, even if they're not seeking coverage. So there will be a portion where you can just check a box that says they're not seeking coverage. But the reason why you want to do that is because it allows for your household size to be fully captured to see how much tax credits you're eligible for. So our site is set up to be self-serve, but I understand that insurance can be confusing, or sometimes it just helps to talk to somebody. So we have trained assisters that are available to help complete applications, understand coverage options, go over tax credit eligibility, and sign them up for coverage. We also have our customer support center that offers language assistance in 175 different languages. So again, important dates to remember. So open enrollment goes from November 1st to January 15th, but to be able to get that January 1st start date, you'll want to make sure that you're enrolling before December 15th, and then any enrollments between December 16th and January 15th will get that February 1st start. Small business support. So I am available to speak with small business employers about their coverage options. So many small employers are unaware of where to start in the process, and it can seem daunting with all the information that's out there. So I'm able to speak to them, help them break down those options so it's easily digestible, and provide them the resources to help them make the best decision for themselves and or their employees. Either that be through an individual plan on Washington Healthplanfinder, or by connecting them to one of our knowledgeable brokers in our enrollment centers to help them explore group plans, HRAs, or HSAs. These brokers are also able to compare group plans and individual coverage to see what would be most beneficial for the business. Other resources I can provide are employee presentations and employee informational handouts to explain what individual plans are on Washington Healthplanfinder. To get access to these resources, you'll want to email me at smallbusiness@wahbeexchange.org. And I'll leave it on the screen so you can have my contact information. You can write that down. But yeah, we've covered a lot of information, and I just want to say, my goal really is just to be a resource for small employers and help them get the coverage that they need. And again, it's either through an individual plan on Washington Healthplanfinder or connecting them to a knowledgeable broker. But in the end, I just want to make sure that they're getting the coverage for themselves, for their employees, they can stay healthy and build their business. So thank you so much. And I will open it up to any questions. It sounds like there are some there.
Bravo. Thank you very much, Marie. I appreciate your spending the time. There were quite a few questions. Thea, would you be okay if we spend a little bit of time on these questions and then go to you? Would that work?
Not a problem at all.
Awesome. Okay. So a person in the chat, Bruno, had some excellent questions. One of them is, I'm a sole proprietor with no employees. I have an ACA policy. Has in the Inflation Reduction Act suspended the subsidy cliff until 2025. I'm referring to the cliff where if you make more than 400% of the federal poverty level, you owe 12 full months of subsidies to the IRS at tax time. Did that question make sense, Marie?
You know what? Let me try to find it really quick within here. When you, can you know what? You want to ask it? Oh wait, I think I found it. Has the Inflation Reduction Act. You know what, when it comes to that, and we're talking about like tax credits and those things, we always refer them to talk to a broker about that, or an insurance broker. We don't really like to kind of give insurance advice like that. So I would refer you to talk to like a tax professional.
Okay. There's another question also from Bruno. When you browse and compare plans under the Washington Healthplanfinder, can you enter whatever demographic information you want? Can you use it as a sandbox, or is all the income you enter saved under your name?
Yeah, the browse and compare plans is just kind of like a sandbox where it's just anonymous browsing. You can go in there and just put in whatever information you want to. But again, to get the most accurate amount of tax credits, and you would want to fill out an application.
Got it. And then also, another question is, can I use the tool to see what happened if making 50,000 or 30,000 or whatever?
Yes, yeah, you
okay.
could.
Wonderful. Another question, basically question is, I called 6 assisters and none of them could answer my questions. They said they could only help me if I filled out an application on the website and could not answer any other questions. Would this be a person who could come directly to you and ask specific questions, Marie?
Yeah, they can come to me and I can help them. And then if it gets into getting into very big specifics about their business, then I would recommend that they talk to a broker to help them with their questions. And we partner with our broker enrollment centers because we know that they are able to also assist small businesses. So if they are even considering or interested in looking at group plans, they can help them in comparing what a group plan and an individual plan could look like for them. The nice thing is because we know that they sell small group plans, is that if they're a business that is just starting out and right now they're in an individual plan and that's what makes sense for them, if they're working with that broker and they have a great rapport with them, they can then, when their business grows and they're ready to start hiring employees and they want to start adding in group coverage, they already have that established relationship with a broker that can talk to them about group plans. So they can kind of transition to that with them and grow with their business.
Got it. Great. I appreciate that. And there's this significant question here about the subsidy cliff. Bruno has asked tax professionals, the IRS, health insurance navigators, who really has that information? This is a matter of law. Is that something he could call you about? You would recommend that he speak to a broker directly or to a tax professional?
You know what, Bruno, come email me, reach out to me, and then I'll get you connected to help figure out your question. Just email me directly.
Wonderful. Excellent. Okay, now I want to go to Thea. Because I think the experience of going through this process as a small business owner is significant and sometimes arduous, but sometimes direct. And your experience, not only being a healthcare professional, but just as a small business owner, is really salient right now. So I want to welcome Thea Feltz. Take it away.
Hello, everyone. Thank you, and great presentation, Marie. So again, my name is Thea Feltz, and I am the founder and president of Comparative Solutions, a health insurance agency, a broker out in Tacoma, Washington. And I have, I worked corporate for quite a long time, been in the health insurance industry for over 15 years. And just about 2 years ago, mid-COVID, I decided, that it was time for me to venture out on my own. And I left corporate to start my own company, and we just reached 2 years. Part of some of the decision-making in leaving corporate is, of course, I have employee benefits through my my job at that time. And it was, what was I going to do once I became a small business owner and entrepreneur myself? And of course, I had kind of a disadvantage or an advantage because me being an insurance broker, I knew the benefits of the Washington Healthplanfinder and that I could come right on to get a plan for myself and my family. So as a small business owner, when I did make that decision to leave corporate insurance and corporate things and be a business owner of my own, I did jump right into the Washington Healthplanfinder, which I was able to find a plan for myself. I did not have to use a navigator or a broker assister in this case because I know the plans like the back of my hand, but I work with a lot of small business owners, solopreneurs, those who have employees 1 to 5, and assist them every day. So it is very important, like Marie said, to either reach out to Marie as the small business coordinator or one of the brokers that they can help you with, or even just finding it. The Washington Healthplanfinder has a great tool that you can just put in your zip code and find a local broker to assist. But, I, again, being a self-employed person for the last 2 years, I've been able to enter in my income according to my growth in my company. And whether that was at a time, Washington Apple Health, because I didn't have any income starting out, to now having actual income as a business, being able to update that in the Healthplanfinder anytime throughout the year to see the different changes of the levels of assistance and or just what my premiums to be has been very helpful. And hopefully as the business does continue to grow, and I know as a business owner, until we get up a decent size, that I'll maintain coverage through the Healthplanfinder, and even my my new employees will go through the Healthplanfinder as well until we do choose to go to a group benefit plan. So it has been very beneficial. They have a great support team that can help, and Washington State has great brokers all around that are free of, most should be free of cost. It should not cost you anything to talk to an insurance broker like myself, or one that you can find through the enrollment centers through Marie, or just by putting in your zip code on the assistance part through the Healthplanfinder brokers. We should be able to help you for free and go into a little bit more detail of the plans, how they work, and find something to fit the business.
Wow. Okay, that was beautiful. And I guess I'm curious, what I heard you say is that even if you don't have a business that's formal yet, you can go to the exchange and just, help bridge that coverage between your jobs.
Absolutely. Absolutely. I talk to a lot of entrepreneurs who are on that cusp of wanting to leave their employer, but they have such great benefits, so even if you're on that cusp of thinking about making this great jump, I don't regret my leap at all for the last 2 years. It's amazing working for yourself and, doing what you love to do, like I do. But even if you're on that cusp, being able to use the browse feature to see what it could cost you, and being truthful about your income, because a lot of times we start our businesses off of savings and things like that, where we don't truly have an earned income. And that's what the Washington Healthcare Plan Finder focuses on, is your earned income that you're going to report on your taxes. So even if you're coasting off your savings, you technically don't have an income, things like that. You may take advantage of the Washington Apple Healthcare, or if you don't want Washington Apple Healthcare and want to utilize your savings, you can opt out of it and still get a QHP, a qualified health plan, to accommodate that bridge while you grow and when you make that transition.
Excellent. Excellent. And so let me just make sure I heard you correctly. So if they go to a broker on the exchange, or Maria, if you meet with somebody from this call or somebody who watches this in the future, and you send them to a broker, that information that they get from the broker should be completely free. There should be no cost to answering those questions. And if there is, they can go back to you and say, hey.
Yeah, as of right now, I can't say if 10 years from now this is still
So right
floating
now
around.
that's the situation.
But yes, but yeah,
Great.
right now their services should be free where they're able to help them. So, and especially navigators, I see that comment that you made, Bruno, navigators shouldn't be charging. So I'm not sure how that occurred and how that happened or why they had said that. So, but those services are free. There are some, like with small businesses, there are some that do charge. Like there are some brokers that do charge a small fee. And what I would say when you're looking for a broker, if you're not going through the ones that I'm offering here and you're going through and looking for brokers on your own, then ask them a question. Like, you should interview them, ask them if they charge a fee, because there are some that don't. And you can kind of move on to the next one.
And the good thing too is you can change your broker at any time through the Health Plan Finder. You do not have to stay with one, maybe because they assisted you before in enrolling. You can terminate a partnership at any time. You can change your broker at any time. So if you do come across one that just some things don't sound right, you do have the freedom and flexibility to work with whomever you want to, which is a great benefit.
Excellent. I also just wanted to go back and make sure we got that question, which was, when will the Cascade plans, the open enrollment is also November 1st?
Yes.
Okay, great. And those of you who are in this workshop right now, if you want to put your information about your business or any other questions, that would be great. You're welcome to do that. I also wanted to share some questions from folks when they registered. They had a question, and so I'd like to do that now if that's okay. So one question was, we're looking at insurance options for our full-time employee. We are a very small nonprofit running a farmer's market. We've considered HSA, the Q-SARA, and a stipend as possibilities. Would you, we would love to have support figuring out the best option for our needs and limited budget. And so Marie, would you begin? And then maybe Thea, if you wanted to add to that.
Yeah. So, so with the Q-SARAs and the HSAs, I mean, those are ways that you can help contribute to your employees' premiums each month. And you can pair that with an individual plan. With the health stipend, it's one of the reasons why I don't have it on the slide when I talk about the different options, is because with health stipends, it's kind of tricky because I know that some employers do use that, but at the end of the day, you're putting that into you're putting it into their paycheck. So it's going to go into their annual income. So it can affect their tax credits if they go through an individual plan to get coverage. So it could bump them out of getting tax credits, or it could sometimes equal out where it's not really beneficial for anybody. Secondly, there is no way to guarantee they're getting health coverage with it. So if your goal is to get them health coverage and you want them to be healthy so they can be there, you can get preventative care so they can stay healthy, grow your business with you, you can't really say, you have to get coverage with this. You just don't know. So that is why I don't put it on that slide, but it is a question that I get quite often about health stipends. So Thea, do you have anything else to add about the other?
Nope, I think you really hit it on the mark. Health stipends, a lot of small businesses go that route because they don't know any others. And so again, it is taxable income and should be accounted for on the individuals. And then with the Q-SARAs and or HSAs, it's always good to talk with a broker through the enrollment centers or one like myself, where we could really go through the how setting that up works for the employer and then how it looks for the employees as well, because that would be tax advantageous for the employer and the employee versus the stipend, which is taxable income for the employee.
Wonderful. There was a question that came in Spanish, and so here's the translated in English question. I think it's very important that it can have a comprehensive health program aimed at small businesses. This will allow us to have the support and with the flexibility and time of affiliation and cost for those who cannot access traditional health systems. And now, I don't think I did that right. but I know that we gave you the question in Spanish. Marie, do you want to
Yeah.
you want to go through that?
Sure. Yeah. So all the plans on Washington Healthplanfinder, they do offer the 10 essential health benefits. So they are comprehensive plans. If you can recall back to that that slide that kind of lists them, where you are getting preventative care, you are able to get prenatal care, you are able to get mental health services, and the fact that you're not denied coverage because you have any pre-existing conditions, or that you you're rated because you have a pre-existing condition also. So there are plans, quality plans on Washington Healthplanfinder that are available. Also, the Cascade Care plans, I think sometimes people see like value and you see, well, what is that? Is this not a good plan then? But they really are great plans. It is the state's initiative to make plans that are more affordable for Washingtonians. So I would also look into that. And then just because the question came in Spanish, I just want to go back to the language support that we offer with our customer service team, where they have a live person talk to you. So it's not through Translate. They'll have somebody come on and talk to you in the language that you need. And we have support in 175 different languages. So please take advantage of that, because we want to make sure that you're getting your questions answered, and you're not feeling any stress because there's any language barriers. So hopefully that will help in getting the needs that you need with your healthcare met.
Thank you. That was super helpful, and that you have actual human beings ready to help you in the language of that business owner is huge. So thank you. We have one more question. Actually, two more. One is, forgive the sound of this blower outside my window. How do I get a selection of group coverage rather than a limited or bad coverage that no employees would want? And Thea, you could answer that if that would make sense.
Sure. So, a lot of times I think there's a misconception of plans available through the Washington Healthplanfinder. A lot of people since 2013 still refer to them as Obamacare, but it's really Affordable Care Act. It was with the passing of legislation kind of before all that. But the plans in the Healthplanfinder do range from bronze, silver, and gold. So there's no bad plans. It just really is your preference. And again, bronze levels are going to have the lowest monthly premium, but higher out-of-pocket costs when you go and seek service. Silver is right in the middle, and gold is going to be higher monthly premium, but your lower cost out of pocket. So you really do get to choose what benefits your family. So there's not a bad plan, because like Marie covered in her slides, all the 10 basic essential benefits are covered, just like in a group standard plan. So it's really to what someone needs.
Super helpful. There is another question. So in the chat, we have someone from Center for Inclusive Entrepreneurship, which is really asking a really good question. So how can a sole proprietor with no employees carry some of their insurance expenses in their business?
I don't mind taking that one. So as a sole proprietor, your premiums are tax deductible. So, as you're carrying your insurance, you would, just write it off at the end of the year, your tax premiums. That's why a lot of the tax advantage benefits like the ICRA and the QSERA are not available to S Corp, sole proprietors, owners that are not full W-2 wage employees in certain circumstances, because of the tax benefits that we can already receive as an owner.
Okay, there's another really good question in here. So from Amanda, it sounds like the ICHRA would allow an employer to cover the health care premium. It also sounds like there will be free health coverage with Cascade Care next season. Is that correct?
Yeah, so it could help with covering the premiums And then the Cascade Care premiums. So if you qualify for it, so it's not that, not everybody's going to get free care next year with Cascade Care. It just depends if you qualify for that. And then if you can recall back on the slide, there are some things that you have to be QHP eligible. You have to make sure that you accept all tax credits. You have to be at or below the 250% of the federal poverty level. So there are some, and then you have to enroll in a Cascade Care Silver or Gold plan. So those are some of the determining factors in there, but it all just kind of depends on, the plan that you choose and then your tax credits.
And I'll piggyback on that ICRA part. So as an employer, if you do offer an ICRA to your employees, because again, as an owner, you may or may not be able to participate depending on your legal structure and the setup of your business. But the ICRA can definitely help cover premiums as well as qualified medical expenses. And as the employer, you determine the allowance that you give to your employees on a monthly basis, and you can classify it out if you grow and have more employees by 11 classes. So it can definitely cover the premiums for the employee as well as qualified medical expenses.
That is super helpful. And what we know is that when a small business gets strong, they've gone through the process of writing a business plan, or they're getting the support they need for cash flow projections, or they're getting sturdy, then they're more capable of providing health coverage for themselves and their employees. And so I want to do a shameless plug to Evergreen BizLink, because on this platform, any business can go 24/7, put in, where they're located, the kind of business they are, what kind of business they, services they provide, and the need they have, whether it's a microloan or whatever, and they will have resources available to them that they can go and get more support from. Like Center for Inclusive Entrepreneurship or Ventures or Business Impact Northwest, all over the state. So do go there and check out Evergreen BizLink. We will be sharing Marie's slide deck, a video replay of this, and resources and links to this webinar. I want to thank these amazing speakers who were outstanding and really, I think, informative to a level of detail that makes me, just a little bit nervous. Your depth and breadth of understanding of this topic is really great. I also appreciate all the people who came to this workshop. Thank you, and for your excellent questions. If there's nothing more, I'd like to just say thank you, and come back and learn more about what's happening in the future. We wish you all well and have a great afternoon.